Hello everyone and welcome to our today's class. My name is Raphael. I'm an expert on psychopharmacology. In today's class, I'll be talking about another class of medication called antipsychotics. What are they used for? Mostly, they are used for schizophrenia, and other psychotic disorders. These medications are the single most popular medications used in the United States. And like I mentioned, for antidepressants, these medications are also broad spectrum antineurotics. Broad spectrum. What does that mean? It means that apart from treating psychosis, they also treat other disorders. So it means that apart from treating psychosis, antipsychotics can be used in the treatment of depression. Can also be used in treatment of anxiety disorder and bipolar and delirium. Yeah, so apart from being used for psychosis, we're saying antipsychotics are broad spectrum antineurotics, just like antidepressants, and they not only treat psychosis, but they can also treat anxiety disorder, they can treat delirium, they can treat depression, and they can also treat bipolar disorder. Now, these medications are very, very potent. They're not only potent, but they're also very effective. Very effective in treating psychosis. So they are powerful medications. And the second law of neurotransmission, says that with great power comes great responsibility. So these medications should be treated with respect. So when you're prescribing this medication, remember that they can cause devastating damage to the patient. So before I look at the details of each medication, the profile of each medication, and why you should use one over the other one, I'll look at the general side effects that these medications can cause. Because when I'll be looking at each medication, I'll be making reference to some of these side effects. Not all of them cause these side effects, but I'm saying generally, these medications are known to cause some of these side effects. And these side effects are called extrapyramidal side effects. So they are known to cause extrapyramidal side effects. So I'll look at extrapyramidal side effects, EPS. This is a very high yield area. Don't go to your board exams if you do not know the extrapyramidal side effects of antipsychotics. And these extrapyramidal side effects, most of them are caused by the fact that the mode of action of antipsychotics has to do with blocking the dopamine on the D2 receptors. So that blocking of dopamine on D2 receptors will determine the side effect of this medication. The blockade can be partial in some medication, and the blockage could be complete, total in some medication, which will determine the profile of each medication. So as you prepare for your board exams, I'll give you a mnemonic that you'll never forget about extrapyramidal side effects. And I call this mnemonic ADAPT. So this mnemonic, don't forget that. ADAPT. This summarizes the extrapyramidal side effects. ADAPT here, I'll start with this one. AD. This stands for acute dystonia. Acute dystonia. This is acute dystonia. How do you tell your patient has acute dystonia? This is characterized by involuntary contraction of muscles around the neck and face. So, acute dystonia, involuntary contraction of muscles around the neck and face. It occurs a few hours, just a few hours after initiating therapy. So it doesn't take long. Acute dystonia. So that is an example of extrapyramidal side effect of antipsychotic. Acute dystonia. Acute. It occurs just a few hours after you've started your patient on antipsychotic. Now, as a provider, when you prescribe an antipsychotic that is likely to cause acute dystonia, you need to add a medication that should be used for the treatment. So, acute dystonia, when your patient has acute dystonia, how do we treat? We treat this acute dystonia by using an anticholinergic, e.g., we can use diphenhydramine, Benadryl, or we can use benztropine. Cogetin. So if your patient is experiencing acute dystonia, we're talking about involuntary contraction of muscles around the neck and the face that starts just a few hours after initiating antipsychotic therapy, you need to act fast and treat the patient with an anticholinergic, e.g. diphenhydramine, Benadryl, or benztropine. High yield, don't forget this. Acute dystonia. Another EPS, we are calling it A here. Another EPS, A, here A will stand for akathisia. akathisia. That's another extrapyramidal side effect of antipsychotic. Akathisia. How do you tell your patient has akathisia? Usually, akathisia comes with restlessness. Restlessness or jittery. At times, it may be confused with anxiety. When you see a patient is rocking on the chair, is standing, sitting, at the same time is acting jittery, is restless, you may think he has anxiety. This is akathisia. And this starts a few days after initiating antipsychotic. So it starts a few days after therapy, after initiating therapy. So just a few days. You'll see a patient being restless. We are calling that akathisia. Don't forget that. And how do we treat that? We treat akathisia. You can use a beta blocker, e.g. propranolol. You can use that, or you can use a benzo, e.g. lorazepam, or you can use an anticholinergic. So that's how you can treat akathisia, restlessness, jitteriness, anxiety, and all that. So don't forget that. High yield. Then another EPS is Parkinsonism. That's another extrapyramidal side effect of antipsychotics. Parkinsonism. You had it right. Your patient will show symptoms that are similar to Parkinson's disease. Okay? Symptoms, signs and symptoms similar to Parkinson's disease. Signs and symptoms that are similar to Parkinson's disease. What are some of these symptoms that you'll see a patient having? You'll see a patient having what we call bradykinesia or akinesia. Your patient will be rigid, so rigidity. Postural instability. Your patient will be half shuffling gait, and your patient will have tremors. High yield. So when you give your patient your medication, antipsychotics, and then he starts showing signs and symptoms that are similar to Parkinson's disease, we are calling that Parkinsonism. And some of these conditions are bradykinesia. Bradykinesia simply means decreased movement, or inability to initiate movements. Bradykinesia. Your patient will be rigid. Postural instability, shuffling gait, and tremors. Now, this can happen after several weeks. initiating antipsychotic. It may happen, it may occur after several weeks of initiating antipsychotics. So if this happens, you need to either switch a medication to a medication that has less dopamine blockade. Medication that has less dopamine blockade. So medications that block dopamine on the D2 receptors completely will cause more of Parkinsonism. So in that case, you need to replace this medication. We shall see those medications later. But at this point, that if your patient is having Parkinsonism, these conditions, after you've initiated antipsychotic therapy, you need to switch a medication or discontinue it. You need to discontinue the medication. So you'll assess the risks versus benefits. If you switch medication to a less dopamine blockade med, or you discontinue, then these symptoms should be able to resolve. And then the last part of adapt is T. So this is very important. Remember our adapt. Then we have this one, we're calling this TED dyskinesia. TD. This is high yield TED dyskinesia. This is another EPS, extrapyramidal side effect of antipsychotic. This occurs after years of using antipsychotics, and usually it has a constant involuntary rhythmic movement around the peri-oral. Constant involuntary rhythmic movement around the peri-oral. And how will you tell that your patient has TED dyskinesia? I'm telling you, don't go to an exam if you don't know the signs and symptoms of TED dyskinesia. And as I said, this occurs after years of use, after several years of use of antipsychotics. It does not occur within hours, it does not occur within days or weeks or months after many years of using antipsychotics. And how will you tell? Constant involuntary rhythmic movement around the peri-oral. You will see a patient having grimacing. You'll see tongue flicking. You'll see lip smacking. A patient will act like chewing. A patient will have excessive blinking. So you see grimacing, tongue flicking, lip smacking, chewing, excessive blinking. tardive dyskinesia. Now, how do we treat treatment? We can treat some medication called valbenazine and deutetrabenazine. This is Ingrezza and this is Ostello. So these are some of the medication you can use to treat a patient with tardive dyskinesia. You can use Ingrezza or you can use Ostello. They're very effective in treating tardive dyskinesia. But before you start patients on this, you need to assess look at their cardiac history. Then another last EPS is not really an EPS, but another side effect of that it's rare, but it's fatal if it happens. I'm not calling it an EPS, but another side effect of antipsychotic. It's not an EPS as such. So we're calling this neuroleptic malignant syndrome, NMS. So neuroleptic malignant syndrome is caused by antipsychotics, particularly first generation antipsychotics. And as a provider, you need to know the signs and symptoms of neuroleptic malignant syndrome. And as I had mentioned in my previous classes, you should never confuse neuroleptic malignant syndrome, which is caused by antipsychotics, and serotonin syndrome, which is caused by the SSRIs. Now, I'll give you an easy mnemonic that will help you remember the signs and symptoms of neuroleptic malignant syndrome, and this will be fever. Now, F, fever, extreme or hyperthermia. So don't forget that. A patient who is having neuroleptic malignant syndrome will have hyperthermia, extreme fever. And then 2, E, encephalopathy. And what does encephalopathy do? It causes altered mental status. So your patient will have altered mental status because of encephalopathy. The V, vital signs instability. So vital signs instability. The patient may have tachycardia, vital signs instability, and then this other E will be elevated white blood cells and CPK. And then the last one is rigidity. Now, the hallmark of neuroleptic malignant syndrome is hyperthermia, don't forget this, and rigidity. Hallmarks of neuroleptic malignant syndrome: fever, hyperthermia, and rigidity. So if your patient has this, what is the first intervention? discontinue the medication right away and then treat the patient. And then you discontinue the medication right away if he's having extreme hyperthermia or this fever or this. As I said, these two will help you distinguish between neuroleptic malignant syndrome and serotonin syndrome. So the hallmark is fever and rigidity. Ladies and gentlemen, thank you for being part of this class. In my next class, I'll be talking about the specifics of each antipsychotics. But when I'll be talking about those antipsychotics, I'll be making reference to these EPS. Thank you.